Hi, Dr. Tracy, pediatrician. Let's talk about potty training. So there's a lot of different opinions about how to potty train your child, but there's a few things that have been actually backed by science, and then I'll give you some expertise of what I've seen over the last 20 years with potty training. So first of all, potty training is something that the child needs to be completely ready for, and most studies show they're not ready until around 27 months. And so the first thing you want to look for from your child is readiness. There's not a specific time that you need to start, and there's no perfect time. The time is when your child is ready. So signs of potty training readiness are the child letting you know when they have already been wet or they've had a bowel movement. So if they let you know they went to the bathroom already and they talk to you about it, that's a good sign of readiness. If they want to be changed immediately after having a bowel movement or after they've peed, that's a good time to start as well. And then just interest. If every time you go to the bathroom, the child is asking you questions, if they want to sit on a potty, they are ready to start. Starting before the age of 27 months is not harmful, but it doesn't help either. Studies show they don't potty train any earlier, and it is a little bit more frustrating for the child and the caregiver to potty train sooner. So here are some techniques that you can use that can be helpful, and there's ideas of what to do if they're not potty training on time. So first and foremost, starting with just positive reinforcement. After the child comes to you and says they are wet, have them sit on a potty while you go ahead and get things like wipes and a new diaper. It starts to let them know that, hey, I have this need, I pee or poop, and I need to sit on a toilet. Even if it's afterwards, it starts getting that connection going. So that's the first thing. And then giving them positive reinforcement just for letting you know and just for sitting on the potty. Sometimes that can be a sticker chart, sometimes that can be a treat, sometimes it's just verbal. Really great job, and doing that every single time. After the child is starting to come to you enough, then you can start to initiate it ahead of time. Sometimes something like a timed schedule can work, where you have the child at home, you fluid load them, give them a bunch of drinks, time when you know they're going to need to go to the bathroom, and have them sit there ahead of the time. Don't wait for them to tell you they need to go because they're going to be confused or scared. So having them sit down ahead of time when you know they're fluid loaded or it's a normal time to have a bowel movement with no pressure, just letting them relax, read a book, sing some songs, distract them. Sometimes you'll get some success and the child will go, oh, I understand. And they'll start to progress forward. Another technique can work if your child is really confused but is interested in potty training is naked days. So naked days are where you spend some time at home and the child's wearing nothing from the waist down, because sometimes the underwear makes them feel as if they're wearing a diaper. If they're wearing a diaper, they're just used to going and it pulls so much wetness away, it's not uncomfortable. So naked days at home can be a time for your child to recognize that they have this urge and ask you what they should do about it. If that's super distressing, they're not ready, don't do it again. You will sometimes notice preschools and daycares do a kind of group effort where every little bit of time, everybody has to go to the bathroom. That does have some evidence behind it that it helps. So takeaway tips from this is starting earlier is not better. Waiting for your child to show readiness, having them go on the potty after they go is a good place to start. Fluid loading them or waiting until you're sure they need to have a bowel movement and then putting them on the toilet ahead of time. And naked days at home can be really helpful. It does not help to punish or discipline your child for not being able to be toilet trained. It is not within their control. They're just not ready. Most children will potty train by the age of 4. But that tells you there's a lot of children that are not fully potty trained till the age of 4. The old adage of they should be potty trained by 3 is really not normal anymore, because what we're calling potty training is different. What we are calling potty trained is completely initiated and controlled by the child. It's not the parent taking the child, putting them over a toilet, they have some success. That's not what we're calling potty training anymore. It's not wrong to do that, but it's not being fully toilet trained. Being potty trained at night is usually by the age of 6. If it's past the age of 6, it still can be normal, but most children are going to go to the age of 6. So I hope this helps a little bit. Don't panic about it. Potty training really should not be super frustrating. If it's really frustrating, likely your child is not better or not ready for it, and you want to try a different approach with them. So I hope this helps. Take care.